Good evening, good afternoon, hello everyone, and first of all, welcome to all of you for our this much awaited educational webinar from 360 Critical Care. And I would be very honest that the registrations for this webinar crossed 250 registrations, which is a huge number, and we have the attendees across the globe. So there are trainees, there are examinees from India, from Southeast Asia, from Middle East, from far away, I would say from Latin America also. So definitely this is a very motivating, and I would say we would be giving our best efforts to help you out in your exam preparation and also in your critical care day-to-day practice. Now, this session is a must-attend session for anyone facing the critical care practical exam, particularly, but we have also included the day-to-day clinical clues, or I would say clinical pearls, that would definitely help you out in managing the patients. So it's not for the exams, rather also straight from tomorrow also you can help out your patients. Now the session schedules, we have the esteemed faculties across the globe again. The first speaker is Dr. Sanant Kumar Das. He is also the course director as well as the 360 Critical Care Academy, the founder, I would say the director, and he is the consultant intensivist from Australia, a very dear friend of me. And the topic I have chosen, as well, I would say assigned to him, is again one of the most sought after domain in the practical exams and also in the MCQ based exams, in the theory exams. And this has been our observation for last 4 years since we started teaching for different various exams, critical care exams like EDIC 1, EDIC 2, the DM exam, DRNB exam, and also the fellowship exams. So that is ROTEM and TEG. And he would be definitely taking you to all the detailed analysis how you should approach if somebody is asking, or is there any report that has been shown to you in your practical exams. Welcome, Dr. Sanant.
Thank you, Tapas, for that kind introduction, and
And
good
with
evening.
this, I would also, Sanat, just like 1 minute, I would invite you for the talk. Now, the next speaker is Dr. Kyrillos Nassim, very bright, young, dynamic intensivist from Cairo, Egypt. And you won't believe he's so much academically driven that he has also many initiatives for the first time in the Middle East, and that is being appreciated by everyone who are preparing for I would say demanding and I would say mark fetching in the practical exams. Now the third speaker is Dr. Jitendra C, a very dear friend and our core faculty for the EDIC 2 exam preparatory course from Bangalore, India. And he would be talking about IABP, one of the most sought after and confusing, I would say. People know about it, but when they would be asked related to some of the troubleshooting, they normally are fumble in the exam. So that's why we have kept the third topic, which he will be talking in the second sequence. Now, the last but not the least, myself, Dr. Tapas Kumar Sahu, again the 360 Critical Care Online Academy, the director, and also I would be talking about ventilator graphics, very much mark fetching, and that would be concluding our session for today evening. Now, just two lines before I will be handing over to Dr. Sanant. What is 360 Critical Care Academy? We are one of the premier, globally trusted, and highly successful online and also on site teaching academy dedicated to excellence in critical care education. And the missions that we started with 4 years back is to deliver world class evidence based critical care education across continents. We determined to bridge the gap between theory, bedside practice, and again, finally, what we normally strive for, that is the exam excellence. We also strive to train clinicians to think like experts, act with precision, and again, lead in their clinical practice with confidence. And the final objective of this initiative is to build a global learning community that is driven by collaboration, mentorship, and innovation. Now, this is something which we thought about and we framed this session. Idea is we have the comprehensive teaching program for all the critical exams and trainees, DRNB, DM, EDIC 1, EDIC 2, fellowship and on-site teaching. The second one, we try to provide education for the entry level trainees also, starting to exit exam talk. And one big news, we are launching soon the 360 Critical Care Academy app, which would be dedicated exclusively for your day-to-day education purpose. And also we would be having all the resources, all the exam oriented teaching and resources, and also the live classes that would be definitely helpful in your like day-to-day training period. Last but not the least, recently we launched one book exclusively for the critical care practical examinees, that is top manual for the critical care exit exam, that has included the cases, the long cases, the short cases, the clinical examination, the OSCE, and we have unveiled this in our recently conducted Mumbai course. But yes, the final version for the mass use, we are expecting this to be in the next 3 months, where you all will be getting if you wish to have one. So with this, we are now into the first class. We named it as, again, from our 360 critical care, we thought about naming this as 360-degree concept. And the concept is to clear all your doubts from the grassroots level. And we will be trying to provide you the basic concept and again to the advanced level exam. For today, webinar is by Dr. Sanand Kumar Das. So I'm stopping to share here. And thank you for again joining. Definitely we'll have a very great session. Already 110 plus candidates have joined. Thank you.